All right, let's just jump right in. Welcome to this explainer, where we're going to unpack the ultimate blueprint for transforming yourself into a licensed dental professional. I mean, if you've ever sat in a dental chair, right, and just marveled at that precise, synchronized dance between the dentist and their assistant and thought to yourself, I want to do that, well then you are in exactly the right place. Today we're breaking down this comprehensive dental assisting diploma program, and we're going to decode exactly what it takes to step into this super high-demand healthcare career. To make this whole journey crystal clear, we've divided things up into 5 key areas: the 55-week blueprint, clinical assisting, office administration, practical experience, and finally, your path to certification.
Okay, starting with Section 1, the 55-week blueprint. This is really your career foundation.
55. Now, what does that number actually mean? It represents 55 full-time weeks. So we're talking about just over a single year of your life to completely and totally transform your career trajectory. Look, this isn't some casual, at-your-own-pace weekend hobby course. It's an intensive cohort-based program. That means you start with a specific group of peers and you move through this rigorous schedule together, typically hitting instructor-led classes about 5 hours a day, Monday through Friday.
And within those 55 weeks, you're going to complete a massive 1,375 total program hours. That is a huge commitment. But why this really matters is because it highlights the incredible balance this program strikes between intense, theoretical study in the classroom and actual hands-on practice in the lab and the clinic. You're not just, reading a textbook about teeth, you are dedicating hundreds of hours to mastering the literal physical techniques you need to safely treat real patients. Now, all of these hours are framed within the CDI College Dental Assisting Program. And a really crucial detail to note here is that this program doesn't just exist in a vacuum. It is officially accredited by the Commission on Dental Accreditation of Canada. Having that specific accreditation is basically your absolute assurance that the curriculum you're learning meets the strict national standards required by the entire dental industry. So the most important thing is understanding exactly what you're training to become, right? You are working toward becoming a certified dental assistant, or CDA. A CDA is a highly qualified, fully licensed oral healthcare professional. You're providing essential support and direct patient care right under a dentist's supervision. In British Columbia, this means you are regulated by the British Columbia College of Oral Health Professionals, or BCCOHP. You're stepping into a heavily regulated healthcare professional with some very serious responsibilities.
Moving right along to Section 2, Clinical Assisting. This is all about mastering chairside care.
Now, this is where the magic really happens. You're going to master something known in the industry as four-handed dentistry. And no, you won't be sprouting an extra pair of arms, I promise. It actually refers to that super seamless transfer of instruments where you literally anticipate the dentist's every single move. But honestly, it goes way beyond just handing over tools. You'll be learning how to take and process dental radiographs, X-rays. You're going to be applying fissure sealants and topical fluoride, placing and removing dental dams for moisture control, and taking highly accurate impressions of patients' teeth. You become an active, absolutely critical participant in the patient's treatment.
So how does this skill set actually build? Well, it happens across the program's 3 terms. Term 1 sets the stage. You're getting foundation science, anatomy, and you're learning to manipulate dental materials like cements and gypsum. Then, Term 2 really ramps things up into operative dentistry, pharmacology, and exploring specialties like orthodontics and oral surgery. But Term 3, that is the absolute peak. You get 260 hours dedicated purely to intraoral dental assisting practice. You'll be demonstrating these highly regulated skills on mannequins, on your classmates, and most importantly, providing direct patient care under professional supervision right in the college's dental facilities.
All right, on to Section 3, Office Administration, Managing the Practice.
Because here is the thing, being a phenomenal clinician in the chair, that's really only half the battle. You've got to master the duality of this role. On one side, you've got the fast-paced, highly technical clinical duties we just talked about. But on the flip side, you have these meticulous, highly organized administrative duties. A modern dental practice simply cannot survive without excellent record-keeping, incredibly efficient appointment scheduling, accurate processing of patient and insurance accounts, and precise inventory control for ordering supplies. As a graduate, they expect you to be highly competent in both of these arenas.
To make sure you can run that front desk just as efficiently as the operating chair, the program actually dedicates a specific 75-hour course entirely to practice management. The big takeaway here is that you won't be just guessing when you walk into an office on day 1. You're going to master reception procedures,
basic bookkeeping from accounts receivable to payroll, fee management, and how to utilize specialized dental management computer software to keep the whole clinic running like a well-oiled machine.
Which brings us perfectly to Section 4, Practical Experience, Real-World Application.
You simply cannot graduate without real-world application. Listen to how this progression works. You will complete a mandatory total of 175 hours of outside practical work experience in a private dental practice. This is actually split into 2 phases. First, a 75-hour Phase 1 practicum, and then a 100-hour Phase 2 practicum later on in the program. Now, while this work is unpaid, its value is totally immeasurable. You are out there, in a real clinic, working shoulder to shoulder with a real dentist and applying your 1,375 hours of training in a genuine, fast-paced, unpredictable healthcare environment.
And finally, we hit Section 5, the path to certification, achieving your ultimate goal.
So, what exactly does it take to finally graduate? Well, the standards are high, which, let's be honest, is exactly what you want in healthcare. To earn your diploma, you've got to maintain an overall average of at least 70%. You must pass both your comprehensive theoretical exams and your clinical and laboratory practical exams. Plus, you have to successfully demonstrate those highly regulated clinical skills on actual patients. And, like we just discussed, you must successfully complete those 175 hours of outside practicum, which is then backed by an official evaluation form from your hosting dentist.
And when you achieve all of that, you unlock the absolute ultimate goal. Graduating from this accredited 55-week program makes you officially eligible to apply and sit for the mandatory Written National Dental Assisting Examination Board, or NDEB, certification exam. Passing that national exam is the final essential key to becoming a fully registered, licensed certified dental assistant, ready to take your place in a general dental office, a hospital dental department, or even a specialized clinic.
Man, we have covered a massive amount of ground today in this explainer. We've looked at the exact blueprint of this 1,375-hour journey, going from the classroom to the clinic and right up to the doorstep of national certification. It is an intense, comprehensive, and demanding path, for sure. So, I'm going to leave you with this final thought to chew on. Are you ready to commit 55 weeks to completely transform your future? Think about it. Thanks for joining me on this explainer, and as always, keep learning.